Hi everyone, I'm Dr. Vera from SL Aesthetic Clinic. Today, we're going to talk about melasma, a common skin condition that many people struggle with. We'll discuss what melasma is, its causes, and the various treatment options available to manage it. Let's dive in. Melasma is a skin condition that leads to dark, discolored brown patches appearing on the cheeks, forehead, and nose bridge. It's typically symmetrical, meaning you'll find matching patches on both sides of your face. This is a fairly common skin condition affecting mostly ladies in their 30s and 40s. While it's frequently referred to as the mask of pregnancy because it often affects pregnant women, melasma can occur in anyone. Melasma occurs when an overproduction of melanin by skin cells leads to the formation of dark patches. There are several known factors that can contribute to its development. Sun exposure is a major trigger. UV rays stimulate melanocytes, the cells in our skin that produce pigment, causing them to create too much pigment. Hormonal changes, such as those during pregnancy or from using birth control pills, can also trigger melasma. Genetics play a role as well, as even though melasma isn't directly inherited, its tendency to appear in people from the same families indicates a possible genetic connection. Skincare products with potent exfoliating agents and acne medications that make the skin more sensitive to light can also lead to the onset of melasma. Now, let's take a look at what the people on TikTok have to say about melasma.
When your skin looks like this, you're about to violate some rules. I've been dealing with melasma for 20 years. I don't know if you know what this does to your self-esteem.
So, I do agree that melasma tends to be a chronic condition many people do struggle with, and clearly she has gone through a lot of psychological distress even battling this for many years. She's right in saying that Hydroquinone and Tretinoin are part of the combination of treatment that we use for melasma. But a couple of worrying things that she brought up that I probably would want to highlight. It's really good that she provided a disclaimer at the end of the video actually, because the things that she are doing may not be part of standard treatment or would really come with a lot of warning, I would say, from any doctor that perhaps chooses to use this form of treatment. So firstly using hydroquinone for a very extended period is actually not recommended as part of the treatment. We do recommend that you stop hydroquinone after several months of use because it can actually lead to a condition called ochronosis, and this actually causes a different form of pigmentation and can even look more obvious and darker, and in fact a little bit like blue-grey in appearance as compared to melasma. So that's definitely not recommended. The second thing is she used both Tretinoin and Retinol, which is really not recommended because they do belong to the same family, and overdosage, I would say, of retinols can actually have side effects such as a lot of dryness and peeling and overexfoliation of the skin. So that is not recommended as well.
Melasma. Anybody have any products, solutions that they love? I am 8 months pregnant, so I know this is partly to do with that. I also have this spot here that's gotten quite a bit darker since being pregnant, but obviously I have spent quite a lot of time in the sun, so I do have a lot of freckles. But this melasma moustache.
So, as mentioned earlier, melasma is sometimes termed the mask of pregnancy because it is influenced by hormonal fluctuations. So what she has experienced is actually something that I would say some people would go through as well due to the hormonal fluctuations that one goes through during pregnancy. Unfortunately, many of the treatment options may not be suitable for someone who is pregnant, for example, retinols or hydroquinone. So if I were to see someone like this in a clinic and she's asking me, okay, what is suitable to be used concurrently with pregnancy, one suggestion could be vitamin C as part of the treatment, and once she's postpartum, she can start to consider other forms of treatment that is suitable for non-pregnant ladies. Due to the higher levels of melanin in Asian skin, melasma can be more conspicuous and difficult to treat. The unsightly pigmented patches on the skin may be distressing, causing sufferers to feel self-conscious and embarrassed. Given the significant impact that melasma can have on an individual's quality of life, it is crucial to have a better understanding of the condition and the treatment options available. Through research, clinical findings, and extensive experience, SL Aesthetic Clinic has developed effective strategies for managing melasma in Asian skin. Lasers are a highly effective treatment for melasma. Our Pico pigmentation laser machine targets and breaks down pigmentation without damaging surrounding tissue. Skin boosters, such as our proprietary glass skin customized skin booster, contains a cocktail of ingredients that not only helps to reduce pigmentation, but even gives additional benefits in terms of skin rejuvenation, hydration, and reducing oiliness and sensitivity. Radiofrequency microneedling, which uses tiny needles to create micro-injuries in the skin, helps to break down melanin deposits in the skin. It also promotes repair of our skin barrier to block further melanin production and helps to treat abnormal blood vessels that drive melanin formation. Topical treatments like a combination of hydroquinone, tretinoin, and steroids, or oral medications are recommended in conjunction with clinic-based treatments to manage melasma. Combining treatment types can provide more comprehensive results for this stubborn, chronic condition. Thanks for joining me today to learn about melasma. I hope this information has been helpful. If you have any questions or want to know more about how we can help you manage melasma, feel free to reach out to us at SL Aesthetic Clinic. Don't forget to like, comment, and subscribe for more skincare tips and insights. See you next time!